Welcome to Life Care for You. Today, we're focusing on epilepsy, a neurological disorder that affects the brain and nervous system. Epilepsy is characterized by recurrent seizures, which are sudden bursts of electrical activity in the brain. These seizures can vary in intensity and affect people of all ages. In this video, we will explore what epilepsy is, the common symptoms, its causes, and the available treatment options. We'll also provide some important precautions to help manage this condition effectively. What is epilepsy? Epilepsy is a chronic neurological disorder that causes unprovoked, recurrent seizures. A seizure occurs when there is a sudden surge of electrical activity in the brain, leading to temporary disruptions in communication between brain cells. These seizures can result in a wide range of symptoms, from brief moments of confusion or staring spells to uncontrollable jerking movements and loss of consciousness. Epilepsy is one of the most common neurological conditions worldwide, affecting approximately 50 million people. It's important to note that having a single seizure does not mean a person has epilepsy. Epilepsy is typically diagnosed when someone experiences 2 or more unprovoked seizures. Symptoms of epilepsy. The symptoms of epilepsy can vary depending on the type of seizure. There are several different types of seizures, but they generally fall into 2 main categories: focal seizures and generalized seizures. Focal seizures, also known as partial seizures, these occur in just one area of the brain. Symptoms may include temporary confusion, staring spells, uncontrolled movements, such as jerking or twitching in one part of the body, sensory symptoms, like tingling or numbness, emotional changes, such as sudden fear or anxiety. Generalized seizures, these affect both sides of the brain and can cause symptoms such as loss of consciousness, stiffening and jerking of the body, tonic-clonic seizure, sudden loss of muscle tone, atonic seizure, sudden, brief jerks of muscles, myoclonic seizure, staring spells with a brief loss of awareness, absence seizures. Other possible symptoms during a seizure include confusion, fatigue, or unusual sensations. After a seizure, a person may feel disoriented, tired, or have difficulty remembering what happened. Causes of epilepsy. In many cases, the exact cause of epilepsy is unknown. However, there are several factors that can contribute to the development of epilepsy. Genetic factors. Some types of epilepsy are linked to specific genes or inherited conditions. A family history of epilepsy can increase the risk of developing the disorder. Brain injuries, head trauma from accidents, falls, or sports injuries can lead to epilepsy by causing damage to the brain. Stroke or vascular diseases. Stroke, which can cause damage to brain tissue, is one of the leading causes of epilepsy in adults over the age of 35. Other vascular diseases that affect the brain's blood vessels can also increase the risk. Infections such as meningitis, encephalitis, or brain abscesses can cause inflammation in the brain, leading to epilepsy. Developmental disorders, conditions like autism and neurofibromatosis are associated with a higher risk of epilepsy. Prenatal injury, brain damage that occurs before birth, often due to poor nutrition, lack of oxygen, or infection in the mother, can result in epilepsy later in life. Brain tumors. Tumors or abnormal growths in the brain can disrupt normal electrical activity and cause seizures. Treatment. Epilepsy is a chronic condition, but it can be managed with proper treatment. The goal of epilepsy treatment is to reduce the frequency and severity of seizures, allowing individuals to live as normal a life as possible. Here are the primary treatment options. Medications. Anti-epileptic drugs, AEDs, are the most common form of treatment for epilepsy. These medications work by stabilizing electrical activity in the brain and reducing the likelihood of seizures. The type of medication prescribed will depend on the type of seizures and the individual's response to the drug. Surgery. For individuals who do not respond to medication, epilepsy surgery may be an option. This involves removing the part of the brain where seizures originate, usually only if that area can be safely removed without affecting vital functions like speech or movement. Vagus nerve stimulation, VNS. This treatment involves implanting a device that stimulates the vagus nerve in the neck. The device sends regular electrical impulses to the brain to help prevent seizures. It is often used in combination with medications. Ketogenic diet. Some individuals, particularly children with certain types of epilepsy, may benefit from a ketogenic diet. This high-fat, low-carbohydrate diet can help reduce seizures in some people by altering brain metabolism. Responsive neurostimulation, RNS, similar to a pacemaker for the brain, this device monitors brain activity and delivers electrical pulses when abnormal activity is detected, preventing seizures. Lifestyle changes. Making certain lifestyle adjustments can help manage epilepsy more effectively. These changes might include getting regular sleep, managing stress, avoiding alcohol and recreational drugs. Precautions and lifestyle management. Managing epilepsy involves more than just treatment. Taking certain precautions can help reduce the risk of seizures and improve overall quality of life. Seizure triggers. Identifying and avoiding seizure triggers can be an important part of managing epilepsy. Common triggers include stress, lack of sleep, flashing lights, and certain medications or substances. Safety measures. For people with epilepsy, safety precautions are essential. Avoiding activities that could be dangerous during a seizure, such as swimming alone, driving, or climbing heights, is critical. Wearing medical alert jewelry can also help in an emergency. Support systems. Having a support network of family, friends, and healthcare professionals can provide emotional and practical assistance in managing epilepsy. Conclusion. Epilepsy is a serious neurological condition, but with the right treatment and lifestyle adjustments, many people with epilepsy can lead full and active lives. Understanding the condition, recognizing the symptoms, and seeking appropriate treatment can make a significant difference in managing epilepsy. This video is for educational purpose. If you or someone you know has epilepsy or is experiencing symptoms of seizures, it is essential to seek help from a healthcare provider or neurologist. Thank you for watching Life Care for You, and stay tuned.